started with Whitehall approximately a year ago because my partner was very interested, and he's been in private practice a little bit longer than me. I joined him right out of the Navy, so I didn't have a whole lot of management or business experience. And so what we did is we set up a meeting with Dr. McCready, and he just sort of outlined for me exactly what Whitehall did. And basically what they've done for us is allow us to eliminate some of the things that were holding us back. And these are a lot of these things were things we didn't know were a problem even. Whether it be the way the staff interacted with us, the way we interacted with patients, the way we got new patients into the practice, the way we integrated new patients and treatment and things like that. And what really happened is we went from sort of a plodding practice where we plodded along and we thought we were doing pretty well to exploding. And what that showed us was we had a lot of other problems, such as capacity issues. At first we didn't think we did because we had enough space for what we were doing, but once we got really, really busy, we realized we needed more staff and more space, and maybe needed to change over some of our staff. And all of those things combined has made our practice explode, both, with new patients, with efficiencies, with money. All of those things have gotten much, much better. But there's also some growing pains associated with it, meaning we did turn over some staff, which at the time, specifically for my partner, was difficult because he had had some long-standing staff members that really didn't want to grow. And once we identified that, we were able to sort of make the necessary changes, and that helped a lot. Like I said, with every growth spurt, you realize you have other issues. Right now, probably our biggest issue is capacity as in space. Because we're a little bit different from a lot of practices in that we have two owner doctors instead of an owner doctor and an associate. So we do everything together, but we're on the same page and it's going well. The thing I would recommend most is for new doctors who are thinking about taking on Whitehall is don't necessarily know how far you can go until you see what the other Whitehall doctors are doing. Meaning, I don't think that, we had a good practice to start with, and we didn't feel, I don't think that we needed to do anything extra other than my partner and I were thinking, how far can we take this? And you really don't know how far you can take it until you talk to Whitehall and see what other practices are doing, and then you realize maybe you're not working up to your potential. And that was probably the biggest eye-opening thing for me is I already thought we were good. And to a certain degree we were.